I can you hear us okay?
I can hear you great. Can you hear me?
I can't hear him, no.
We can't
No?
hear you. Give us a moment to find out.
Yeah, sure. Go ahead. No problem.
How do you find out how to hear him? Maybe we'll take this. Can you hear us? Yeah.
Can you hear me?
Perfect.
Okay.
What was wrong?
We figured it out. It's our first
How you guys doing?
wrap, so please bear with us.
No problem. How's it going?
It's
Very
going
good.
All right. Well, welcome to Pitch Investors Live, man. We are changing the way that entrepreneurs pitch investors and changing the way business is done out there. We're so excited about so many great things going on here on our platform. So welcome.
Well, thank you for having us.
Yeah, I apologize for last week. I think we were supposed to do this last week, right?
Yes.
Yeah, I had my second child, so
Congratulations.
yeah, thank you. It's been a fun week.
Well, that I bet with a newborn.
Yeah. So how's everything going with you guys? Good?
Doing very well, thank you.
Where are you based?
Florida.
Where at?
We're in Tampa.
Oh, cool. Very cool. Yeah, we have offices down in Tampa or St. Petersburg, but and I'm in New York.
Oh, okay. Well, you're not too far. You're still in Eastern, right? So.
I'm there all the time. Yeah, I'm there probably once or twice a month, actually.
Well, are your headquarters here in Tampa or over there? Oh, they're here.
Yep. Oh no, St. Petersburg.
Oh, okay.
Yeah. So love to hear more about what you guys are doing.
Okay, sure. So I will start. My name is Gloria D. Cordero, and I am the Chief Information Officer for SciX, and this is Joanna Gamble George, and she is our COO and our Chief Scientist as well. She's a neuroscientist, and we've been in this industry for a very long time, over 20 years. A little bit about our story and how this all came about, SciX. How was it born? Why did it all come together? We started grad school together, and we just wanted to do something together.
By the way, your video just went out. Oh, there it is.
Is it okay? Yeah.
Yeah, you're good.
Confirm something. So we had before we. But we were in grad school together, and we were taking a look at biotechnology, and I've been a gaming developer for multiple years and created a lot of different technologies, and we decided to come together to create bio sensors and devices that would monitor, predict, and prevent medical events from medical life-threatening events actually from happening. Joy, would you like to enter?
So basically, SciX, we're like a software application and device development company, and what we're trying to create is a software application that can integrate into wearable devices, such as like a ring. And basically what it'll do is make sense of pre-existing medical information as well as the biometrics that you get from the biosensors from a wearable device. And whenever you have abnormal changes in your vital signs, such as to a cardiac arrest or respiratory distress, what it'll do is it'll send out an alert to EMS to actually come out and get you in your home to take you to the hospital. If it's not too much of an emergency, what it'll do is contact a medical professional like a doctor, and then the doctor will it's about what you can do to change your behavior in order to get your vital signs back to normal. So that's what we're trying to do right now, is raise money to basically create this product that we call Cyrene.
Right, and the other thing to talk about in this alert system is that we have placed it on a blockchain technology, our blockchain platform. We started to program all of our own smart contracts and algorithms that are looking for those proof of change. We started to do this last year, about December, and we started to regulate a lot of the data within a system that can actually distribute new information to all the patients within a network in real time. So that aggregation of data is extremely important, because if our system finds a new variable for a heart attack, every patient that has that condition can now be monitored for that variable as well. And that enables us to continually, progressively find new alternatives for medicine, new alternatives for solutions for different conditions within those populations of patients, utilizing the data that is aggregating in real time to help them and to really be able to monitor their conditions properly.
And it's all through the ring.
Well, this ring is for the cardiac. So any heart conditions, this would be
Okay.
Monitoring that. We do have other device applications that have biosensors in different formats. We have one that will go here on the neck that will monitor a stroke, and it will enable people that have stroke to have peace of mind of knowing that it's constantly monitoring all of the biometrics necessary for that specific condition. So we really actually look at every threshold for all of these conditions in real time, and then we try to program it so that the threshold gives enough time to save the person's life. And that is really where all of the biometrics and all of the clinical trials we are right now regulating and programming is very beneficial. You really do have to continually look for those new variables and then find thresholds that will monitor that specific time frame, so that you can then push the envelope and say, this is where the person needs to be alerted, or this is where EMS needs to be alerted in order to save that individual.
So is it an open source type platform where any person, or maybe maybe it's specific to medical professionals, can input, data into it, where it creates the algorithms and the variables that could then, determine new effects or new diseases or whatever it may be?
Currently, would you like to?
Oh, so it wouldn't be completely open in terms of, with the word about HIPAA laws, but
right.
But what were you saying about we would be able to do that down the line, where you can actually pick up on new, I guess, patterns that might lead to a particular disease or a condition.
Mm-hmm.
We can filter that information into a front end, but our blockchain is permissioned based, so you do have to be registered within in order to secure that network properly, and only through the initiation of that patient saying, yes, I want to be a part of this network, and obviously their device being registered within, it starts to monitor that device for that patient, and they are the ones that initiate that with their doctors. That enables for us to be HIPAA compliant and be able to be within a larger network of patients without ever getting into their IDs or.
That's amazing. Yeah.
We really do have to secure IDs, and we mask identification of all patients even before they enter our blockchain.
No, it makes perfect sense to why you're utilizing that. What platform are you building on?
We are using IBM's blockchain platform.
Okay.
We've been using it since they started. They've introduced us to it when they first started to put it together, and we use Linux as well. We are trying other types of networks that we've seen out there in platforms. We just feel that IBM's the larger company that really is pushing the envelope with it and adding the tools that we need in order to really establish a good foundation for what we're doing.
Right. So about the product and technology first, I want to ask a couple questions. What stage are you in right now? Like, talk to me about the roadmap of where you're at right now, and then, I guess there's multiple components. One is the, physical product that you need to manufacture, develop, and the technology within that, and then the other is obviously, the build of your blockchain technology that you guys have to build. Where are you at with all of those aspects, and where do you see the timeline of actually launching
Sure.
this product and
Do you want
business?
the proposals and then?
Okay. So right now we're submitting like grant proposals, just trying to get enough money in order to create the product itself, but also to do the research to show that it's feasible and also to ensure that it has efficacy and it's effective doing what it's supposed to do. So that's what we're trying to do right now. I think it'll probably take us like 6 months because just to get all that done, I think for the grants that we're applying for, you have to have it done within 6 month time frame.
Right.
At most, we would go out to a year and no later than that.
Yeah.
Okay.
We've already submitted 4 proposals. We also were selected by the NIH to help us with this process, and we have been really working with our team in trying to continue the development and design of the product itself and the technology, the platform that we want to create as a standalone outside of the IBM product is our own. We want our own virtual machine that has the artificial intelligence and all of our algorithms built into it. That is coming into fruition quite quickly. I would say in the next 6 months, we should have all of that established. But currently, we do use the third-party applications that are out there. The ring itself, I do have a prototype already, and we have had this in development. If you look closely there, you can see it has a chip, and that chip is already programmed, and it's actually analyzing data and aggregating data into a smaller, MVP that I put together that is aggregating the data from my own biometrics to utilize as a part of the development process. So we do have that in production, and the Arrow company has been working with us since January in actually creating more of these devices so that we can actually go into deployment once we have the projects that we've submitted for. We submitted 4 this past month, and we're about to submit more in October. And there are 9 agencies that we've spoken with, and like NASA, we've been invited to speak to NASA this coming month in October.
That's awesome. I appreciate that so much, because a lot of people who may be watching or may not be watching don't understand the development cycle of just even forget the technology, just even the product,
right,
of the ring, right? I mean, we've developed thousands of items over the years, and could take something like that with technology built into it like that. I mean, that could take years to develop. So that's amazing. I think I lost you guys. Okay, there you are. So that's very cool to hear. Very happy to hear that. Walk me through. So I'm just looking at your website right now. Don't think I'm not looking at you. Walk me through the the token aspect and the coin and all that stuff.
Sure. So in January, we started to put our own token together. This is the way that we're going to create an economy within our platform to give people incentives with all of their health, right? With all their health and wearables, inspire people and keep them engaged with using the devices, going into therapy. We also have partnered with an AR/VR company that they're conducting a lot of research and want to engage within physical therapy. And so the platform that we wanted to create, we want to add an economy into it for rewards and to motivate people with their health and fitness and wellness, as these devices are now becoming a part of their everyday life and utilized for their health conditions. As a part of that, we actually established our own token. It is an ERC20. It's in the Ethereum blockchain, and we wanted to utilize that to fundraise. People can purchase it. It will be in the exchange market. Once we go through we went through a private ICO process.
You did that already?
We did. We had 15 days of that, to speaking to different investors and getting a sense of what was out there and how to actually implement it. And then once our ICO has gone, and we've gone through that, I believe we're going to be able to place it in a lot of exchange networks that have approached us and would like to list it within their cryptocurrency exchange. And people cannot just exchange it within the market, but they can utilize it within our system to really to become a part of this bigger entity, right? This big new mindset of health and how we go about monitoring health and making people healthier overall.
Sure. So you've developed it as a true utility. Do you have legal opinion letters based on it as a actual utility?
We do have most of the documentation that you are requesting in terms of it is a utility token. We have registered it and we've gone through that process. We spoke to an SEC.
SEC.
Yeah.
Yep.
Spoken to two different attorneys that told us we were in good standing, and we were for all of that before we even released it into the market. So all of that has been taken care of, and it has been in the Etherscan. If you go to Etherscan, you will find us in there. We have gone through the process with each of the entities that we needed to before it was released. Yes.
Okay. Okay, cool. So you did a private sale so far, just to accredited investors?
Sale, yes.
And how'd that go?
We had 58 token holders that wanted. Some of them bought one or two. Some of them bought a few dozen, but not a lot. We sold, I believe, it was about 13 to 14 tokens total. Again, we did it as a practice run, and really advertise or anything for it. We just spoke to people that we knew, and friends and family, and some of our board members that are part of our advisory board. They were the ones that really initiated and spoke to their friends and family, and that we started back in February of this year.
Okay, I have not I have not looked at your white paper or anything. I will do that. I'm on your site. What are you selling the tokens at? How much?
I believe that we were selling it at 10 cents a token.
Okay.
It was either 10 cents, and then some people paid $1 per token. It was valuated at $6 a token at one point, but
okay.
We sold it at $6 a token. I believe we were selling it from 10 cents to $1 a token.
Okay. And are you doing a public ICO?
We can initiate one.
Yes,
yes, we haven't done it yet because we were pitching to investors who wanted equity and other types of investment opportunities, and so we just didn't initiate an ICO yet.
Okay. Okay, cool. So how much are you actually looking to raise?
Well, we initially wanted to raise in total 40 million to really to secure all of the production that we're doing, all of the device applications, and all of the research that we'd like to conduct with a minimum of 1 million as a start off.
Okay. Okay, cool. Let me ask, backing up a quick bit, the actual physical the ring, is that your only prototype, or do you have you're actually in development, you're actually in manufacturing of that right now?
This is the only working model, yeah, but we are actually developing more. Arrow, the company Arrow, we are connected to their engineers, and they've been working because they do have our info chips already. And we've been working with them to send our algorithms and to start to integrate the chips and the biosensors necessary to make them functional. within our system.
Cool. Okay, very cool. So I'll say a couple things here, and then I'd like to follow up after doing some more diving into some of your things here. But we're actually involved in a artificial intelligence platform built for the medical community based on blockchain. I believe it's going to be absolutely ginormous. It's in development right now, and it's very unique. Don't want to talk too much about it, but it's very unique, creating artificial intelligence
Sure.
that's going to save lives and going to be a game changer in all types of medical business. There could be some tie-ins here.
Yeah.
I could see a lot of tie-ins here actually, utilizing potentially utilizing their data, both ways actually, and actually benefiting each other. So we could talk more about that. They're based in California. What I would like to do is, I have your white paper here. I'd like to kind of dive deeper into it, learn more about all of the economics, learn more about the product. I want to have our team, or specifically also our legal team, look into all the legal aspects, because we've seen the good, bad, and the ugly of everything blockchain, cryptocurrency
Yeah.
over the last couple of years, and there's a lot of things that we know to look out for. So I'd like to kind of dive into that a little bit. I also think that we should meet up. I want to actually see the coin, or not the coin, the ring, and any other actual product that you're developing, because just the one concern I have in general, and listen, maybe if it saves lives, it's not a big thing. But me, for example, I wouldn't wear another ring. So, is that a concern? Are there other things that you could do? Maybe like a small sticker or a patch or something like that, versus an actual ring, because a ring. I know a lot of people hate jewelry. I know a lot of people are into fashion, and it may not fit their look and design and all that stuff. So having a product roadmap is extremely important. It sounds like you guys are already creating it, thinking about that, and you said the neck thing
Yeah,
and all that.
we have different device types and different device applications. The great thing about biosensors and just the usage of these different, these new ways of, just like you said, we can add these chips in different ways, as a sticker, as a tag, just within any type of wearable. We do have to keep in mind that it is monitoring certain biometrics for a
Yeah, I get it. Yeah.
So it comes into it comes at some point whether the person wants to monitor that condition effectively, right? With that a specific device, and whether there are other methods to regulating or extracting that information with a sticker in a different place.
Yeah, I mean, even like
Looked into it.
even like in the hospitals now, where they used to put those big finger things on your, now they're using these tiny little finger stickers, and it's getting all the stuff through there. So as technology increases, I'm sure there's more and more. So listen, I just put my email address in here. Do you see that?
Yeah.
Brian@kevinharrington.tv. If you guys don't mind, can you just shoot me a quick email, just so I have your contact info?
No.
And allow me, I think I have everything here on your site that I need. But if I have any questions, I want to have your contact info, and then we could set up maybe an in-person meeting in Tampa or St. Pete, whatever it may be. And just allow us to kind of take a little deep dive into this, because I think it's interesting. I think at the very least, there could be some synergies with that other company that we're working with that could each benefit each other also.
Absolutely. We'll send you an email. We do have a packet of kits that we put together, and we'll send you the kit with a
Please do.
information, everything that we have, we'll send it to you.
Cool. That's great. Thank you so much.
No problem. Thank you for having us.
Thank you.
Yeah, no, thank you. Thank you so much. I hope you enjoy this Pitch Investors Live platform. It's very, very cool. And
Very.
as we keep going here, I mean, just a little add on to that. As we keep going here, the technology that we're building on this platform on Pitch Investors Live every day is getting better and better and better. And there's really some great announcements that the team is working really hard on. That's going to be coming out here shortly.
Wow.
We just had a great call this morning, and it's just so exciting. And this is going to literally change the way that business is done like this. So we're so excited. So thank you so much for joining us here.
Thank you so much.
Yeah, no problem. Have a good day. We'll talk soon.
You too. Bye.
All right. Bye-bye.